Located in many towns throughout the country, food deserts are urban neighborhoods and rural towns without ready access to fresh, healthy, and affordable food. Instead of supermarkets and grocery stores, these communities may have no food access or are served only by fast food restaurants and convenience stores that offer few healthy, affordable food options. In hundreds of neighborhoods across the country, nutritious, affordable, and high quality food is out of reach, particularly in low income neighborhoods, communities of color, and rural areas.
As a middle school health educator, I've seen some of the firsthand some of the diets that some of our youngsters are consuming every day. Food deserts should be a top priority in our society, as many children are not receiving proper nutrients daily to ensure themselves a healthy lifestyle.
In addition to areas of poverty, food deserts are also associated with vehicle availability and the use and accessibility of public transportation. As you can see in the image, food deserts are predominantly located in the southeast parts of the United States. Overall, approximately 23.5 million Americans reported living in a food desert. However, food deserts are often underreported because the North American Industry Classification System places small corner grocery stores in the same category as large grocery stores such as Safeway and Whole Foods. So, what causes a food desert? Research has shown that various demographic and economic characteristics attribute to the frequency of food deserts. Generally, living in an area more than 1 mile from a supermarket or grocery store without access to a vehicle constitutes living in a food desert. Furthermore, many individuals find themselves living in what becomes a food desert when supermarkets are forced to close due to various economic reasons.
So why should we care about food deserts? The people who live in food deserts are unable to have a healthy, balanced diet. This results in poor nutrition. A study by Seth Rundak in 2014 looked at the relationship between academic performance of fourth graders in New York school districts and the proportion of those students who lived in food deserts. Results showed that school districts with higher proportions of students living in the food deserts had lower academic performance in science, English, and math. This supports the idea that poor nutrition due to food deserts can negatively impact the cognitive development and IQ of children. Children are not the only ones affected by food deserts, however. Adults are at risk for poor nutrition as well. People who live in food deserts are more likely to be obese, to have high blood pressure, high cholesterol, diabetes, cardiovascular problems such as stroke, and simply poor overall health. Poor nutrition and obesity are also linked to mental health problems, such as depression. The communities within Baltimore City are also at risk for these negative health impacts associated with food deserts. As you can see in this map, a significant portion of Baltimore City is considered to be food desert. A study funded by the Johns Hopkins Center for a Livable Future conducted a community food assessment starting in 2006. They looked at corner stores in 13 neighborhoods in southwest Baltimore and found that 76% of stores did not sell fruit or vegetables, 15% did not sell milk, and 20% did not sell any bread. Of the stores that did sell bread, only 24% offered more nutritious options. With the vast prevalence of food deserts in Baltimore City, what can be done? Fortunately, there are multiple options available to combat the problem of food deserts. One solution is to encourage corner stores to sell healthier food options such as fresh produce. This can be done through providing these corner stores with monetary incentives to help cover the initial burden of changing their food inventory and stock. Another option is to provide a mobile food market service to citizens in need in Baltimore City. Mobile markets can be buses or trucks that are outfitted with refrigeration units for the sale of food items. An option similar to mobile food markets is the Movable Feast. The Movable Feast is a program based in Baltimore City that serves people within the city and in surrounding counties who are unable to obtain nutritious meals due to severe illness. This service brings healthy, balanced meals at no cost to people who would otherwise become malnourished because of various medical conditions. Lastly, an option that has become popular in other cities around the country is a community garden. A community garden gets local residents together to plant and harvest their own fresh food, which increases the health of the residents and brings about a sense of caring for the community. Together, we have the power to put an end to food deserts in Baltimore City. The future is in our hands.